All right, everybody, welcome to another episode of the PTA Inspire Series. This is a series I do with my coaching students to basically showcase students that I feel like would inspire a lot of students who either might be struggling to pass the boards, maybe it's your first time going into the exam, you're having a lot of imposter syndrome, or you just want to learn, like, hey, what mistakes did other students make in the past that I definitely don't want to make moving forward? And so with me, I have Breanna Stapleton. So another Breanna. So this is great. We have two of us. This is amazing. And she was one of my students, and she just recently passed her exam in January of 2025. So I'm really excited to have her here with me because she's got a story that definitely is going to inspire a lot of people. And first of all, like after working with you for a little bit, like I knew you're going to pass. Like I knew you're going to pass with flying colors. And I knew you'd be a perfect person for this series because I think a lot of people might even be in the same shoes as you and might be dealing with some of the same struggles. So they want to see how you were able to turn everything around and get across the finish line and pass this exam. So, hello, welcome. Thank you for being
Hi.
here.
Thank
I
you.
appreciate you doing this. It's definitely going to help a lot of students. But first of all, I always ask everybody. I know a little bit about this story, and I always learn new things about my students when I do this. But what made you decide to become a physical therapist assistant?
Well, it started when I was in undergrad. Oh my gosh, sorry, my dog's gonna be howling. Don't mind her. Um, it started when I was in undergrad. I was going for kinesiology and I didn't really know like what I wanted to do with that. I just know I wanted to be in like sports or something that involves sports or muscles or moving, all that stuff. So I actually met somebody who was a physical therapist and we I played recreational soccer, like just recreational. And when someone would get hurt, she would be like, "Move, I'm a physical therapist." And she would just like run on the field and like, try to like assess what happened. And I was like, "Oh wow, that's cool." Like I want to do that, Like I was like, I want to be the one that they like, like, "Move, she's a doctor," whatever, right? But at that time though, physical therapy was a master's degree. So I was like, oh, okay, yeah, like that seems easy enough. Like I could just go like a couple more. I was ready to get my bachelor's, so I was like, I can just go a couple more years and get my master's degree in physical therapy. And then it changed to a doctor's degree. So I was like, okay, well, the next thing I can be a PTA. So that's pretty much. So I talked her ear off and I was like, tell me everything, And she was a travel physical therapist, so she would like go to like new states for a little bit at a time or go here, go there. So I was like, okay, yeah, like that's something that I would be interested in. And then yeah, so I just wanted to be helping people and, yeah.
That's awesome. I have a friend right now who's going to be doing travel physical therapy, and it's kind of interesting that a physical therapist was the one running out on the field. I feel like that's usually the athletic trainer. Was she also like an athletic trainer as well?
No, she wasn't. She was just like, mm-mm. Yeah.
Gotcha. So, did you have like when did you start like shadowing physical therapists, and when did you apply to school, and when did you go through school and stuff like
It was
that?
in my undergrad. I was talking to my advisor. It was like maybe 2 years before I was supposed to graduate. And he was like, "So what do you want to do with this degree?" And I was like, I don't know. And then that's when we started talking about physical therapy. And he was like, "Okay, well, if you want to look at schools, like while you're it's still an undergrad, like you need to look at what they require and you need to go look at like observation hours." And this was like also during the time of COVID. So observation hours were very hard to get. Um, and so there was this very small practice in where I live at. And they took me in and they're like, you can watch what we do if you have any questions, whatever. So that's what I did. And it was a outpatient clinic and it was very small and the population was probably a lot of older people. And so it was like they weren't busy at all, like if ever. Maybe they saw like maybe 6 or 7 patients a day. And so I was like, okay, yeah, like this is cool. Like, I mean, like that's all they do, like they help people, they massage them if needed. So then I was doing that observation hours. And then after I graduated, with my bachelor's, I applied for a physical therapist assistant program. I got accepted. And then during that time of waiting, though, I did take a job as a PT tech. And then, so I was like, because I want to get more hands-on experience. I want to get more, like insight or just so I can be prepared for school, I guess. And yeah, and then I was a PT tech for about a year into school because it was also during COVID time. So a lot of my classes were on Zoom. So I could like go to work, come back home, do Zoom, and then go to work. So it wasn't that hard to juggle school and work at the same time. Um, but yeah. And then I graduated or I applied for the program 2021 and then I graduated school in 2023.
There you go. So when you were in school, what struggles were you having with classes, or did you have any struggles with your classes and your internships and stuff like that?
I would say personally, yes, because I ended up getting pregnant my first year of PTA school. And so that was hard because I guess during the classes it was okay and I was able to focus, but during the like practicals and stuff, like I couldn't do a lot. So I felt like I was behind in that aspect. Um, because like I was towards the end of the practicals, like I was pretty far along, like 7, 8 months pregnant.
Mhm.
And then yeah, so there was a lot that I couldn't do. They're like, oh no, you can't do unbreathe because she's pregnant. So I would just have to watch. I couldn't physically do it. And then my partner would have to partner with somebody else because I couldn't physically do it. Um, so those were struggles for me. And then I also gave birth during the last year of my school. So I gave birth in February and I was supposed to graduate in May. I did end up graduating, but I was behind still. I was able to walk the stage, I guess I should say. I was able to walk the stage, but while I was walking the stage, everyone was done and I was still going through clinicals. So I graduated on that Saturday, and on that Monday, I still had to go into my last clinical rotation. And so yeah, so I did my first clinical rotation. I did outpatient rotation, and that's when I found out I was pregnant. And then my second clinical rotation, I was about 8 to 9 months pregnant, so I couldn't lift any patients. Patients were actually like, "Oh no, you don't get that. I'll get that." So I felt bad. I was like, "No, like I'm here for you." Like and they wanted to like, "No, no, please, you're pregnant. Don't do anything." And so I feel like I was waddling everywhere my and the second to last rotation. I had swollen feet. I like needed to take a breath like it was hard. But I pushed through it and then after my second to last rotations when I gave birth. And then I ended up having a C-section. So that also hindered me because I had to do one more clinical rotation and no one wanted me because they were like, well, she just had a C-section. Like she's not going to be able to lift patients. So they're like, so my teachers had to like juggle. They're like, sorry, Bree, like you were supposed to go here, but that you can't go here now or whatever. So I went through like 3 places that for somebody to take me. And I was like, it's been past 6 weeks, like I've been medically cleared by my doctor, like I'm okay. But they still were like, no, we don't want that on our hands, pretty much. So then um a place finally took me and it was at a sniff and I was able to lift patients and I was able to like I felt like I had my body back. And so although there it was an issue with me having to pump every 2 hours because like it was a skilled nursing facility and the flow just goes, and then I was like, oh, but I gotta go pump, so it was like and my CI was like, okay, and it was like every 2 hours, so that also I felt like held me back a little bit because I wasn't able to see a full day. Like it was literally every 2 hours, like I was gone. Okay, like 2 hours on the clock got by, so um, but yeah, that's just my personal situation, I guess.
Yeah, and I'm sure there's a couple of students listening to this right now that, have gone through similar things and they get it. They're like, I'm trying to learn, but like I also have the responsibilities of being a mother. Like I had this, I'm sure people also understand, having a C-section and stuff like that and how that's going to impact your body, especially trying to work with patients and stuff like that. And I think that's a very inspiring story because I think this is like real life stuff that I think
Yeah.
people gloss over and try not to talk about, but it really is like true struggles that it's just like you almost feel like you're penalized for like being a
Yeah.
mom in a
Hmm.
sense, but it's like I personally don't have kids, so like I obviously can't relate to that side, but I mean as a woman I can relate to the
Yeah.
hey, like my body can do some pretty cool things. Like I can't
Hmm.
believe I'm being penalized for this. That's like
Yeah.
outrageous, but I'm glad that you found places that finally made it through and it sounds like you did have people advocating for you, which is
Hmm.
great. And you got through everything and that's also something that I think people need to realize like even if it's not exactly as planned or like the path that you thought like everything was going to be laid out and take like you do have the ability to get to the finish line. I think that's
Hmm.
something that a lot of students sometimes get lost in the sauce almost or get worried about when they're finding these like setbacks and stuff like that or like detours they kind of have to take. So I think that's really inspiring though. You got all of your internships done. Sounds like you got a variety of different settings as well. So
Hmm.
do you have any sort of settings that you're thinking about going into currently?
Um, I think I'm gonna do a sniff.
There you go.
Yeah. I like that it's very every day's different. It's like all
Mhm.
the patients are different, every day's different. It's not like outpatient where like, it's kind of tedious, I guess.
No, yeah. I know I have friends that like absolutely adore working in SNFs. I have one friend who like does exclusively travel therapy in SNFs and they
Oh,
they
wow.
love it. I'm an outpatient girly, but I mean, I want you to find what works for you.
Yeah.
I do enjoy like the multidisciplinary approach that SNFs have where you're getting to work with the different members of the healthcare team. That's
Yeah.
like super, just amazing that we get to like work with other people and kind of coordinate things. I think that that's
Yeah.
awesome because sometimes in outpatient land you don't really get that. So I'm glad that you're kind of working towards that. So when it came to, so you're able to complete everything for your internships and stuff like that. When it came to the boards, kind of walk us through your journey with the boards and your attempts and whatnot.
So, I took the boards 5 times and I passed on my fifth attempt. Um, the first time was that May, everyone graduated from my class, and the next exam was in July because everyone was supposed to take it in July because that's what like the teachers prep you for. They're like, sign up, this is the exam date, like all this stuff. And I mean, they came to me on the side and they're like, you can wait till October, like if you want, like you can wait, like it's really okay. Like, but I felt the pressure of like, no, well, all my classmates are gonna take it in July, so why can't I? Like, so that was my thought process, I guess. And I clearly wasn't ready. I mean, like, I had a 3-month-old newborn who wasn't sleeping through the night, who, exclusively breastfed when I was home, so she required all of my attention. So I was like, no, I can do it all, like I can do all that, be not real well rested, and I can still study, like, and my husband worked full time, so it was literally just me here by myself with my daughter. And I was like, yeah, so I was like, no, I can do it. I can get some studying in, and on the weekends I can go study with my friends. In which I did, but clearly I wasn't ready. So I took my July, I sat for my July exam, and I failed. I got a 577, I want to say. And so I was like, oh wow, like I was really close, for not being as ready as I thought. I was like, okay, well, I'm gonna take it again in October. So I studied all for 3 months, and I was like, I'm gonna take it in October. I got this, like I got a 577, like I'll do better. And so, and I was also like, oh, my daughter's gonna get older. She's not gonna need me as much. No, I was wrong. And so, so I was like, I sat for my October boards, and all the materials I use to study, I use like score builders. I took the score builders exams. I don't think I took any Pete's now that I'm thinking about it, but I don't think I took any Pete's. I used a score builders book. And I took or I used a base camp. And so I was like, those should, like do the trick or whatever. So I sat for my October boards, and then I actually did worse than my first time. I got like a 548 or something like that. I don't, it's a 540s. And I was like, oh my gosh, like how did I do worse? I was like, I was so close, so I didn't give up. I was like, I'm gonna do it again in January. So I was like, I'm gonna keep going. I'm gonna do it again in January. And I was like, this will be my third attempt, like um yeah, so then I did it again in January. And in January, that was 2024 last year, and that's when they changed it. They changed all the boards. They changed the questions. They added scenario questions, and they changed the book. So I had to buy another book. And I had to read that one from like front to back because I was like, I don't know what the difference is, but I'm not gonna skip over anything. So that's what I did. I bought a new book and I started just going through it. I had a study plan, I thought. And then yeah, so I took it again in January, and I failed again, and I think I got like a 578 maybe, like 1 point than my previous attempts. And I was like, okay, like I'm just like in that range, like something's wrong, like I don't know what it is, but like I don't know. So then I took some time off, and I was like, I just need, well, I think I had to actually, because that was
Yeah,
my,
so not to interrupt, but
yeah,
if you don't pass the exam 3 times in a row, like if you
yeah,
take it three consecutive times, they force you
right,
to wait 6 months.
yeah.
So that's
Which
something to take.
I didn't even
Yeah.
know that. I just took 6 months off, like just for, and then I was thinking, I was like, you know what? I think since I took it 3 times in a row, like I couldn't have sat for it in April if I wanted
Mhm.
to. So yeah, so I took 6 months off, and I took it in July of 2024. And that was my fourth attempt. Yeah, so I took it in July 2024. I failed that one. I got like a 586, I want to say. So I was like, oh my goodness, like I don't, and I was literally studying for like, well, maybe I took some time off. I took like 3 months off to where I was like, you know what, like I was studying so much to where I felt like I wasn't even like paying attention to my life around me, like my daughter, my husband, so I was like, let me just take some time off, focus on them, like get out of the mindset of like studying and like because that consumed me so much. And so I took it again in July, and then I think like maybe a month before July is when I found your podcast. And so I was like, oh my gosh, I found this too late. Like I was like, I'm about to take it in a month. Like there's no way I'm about to find like anything else. Like I'm about to like cram all of this information off into your podcast. So I was like, she finally like she broke it down for me. I was able to understand it. And I was like, but it's too late. So then I took it in July. I failed. I got like a 586 or so. And then so that's when I was like, you know what, like I just need to do something, change something. This is my fourth attempt. I have two more tries. Like I need to do something. And then that's when I found your coaching program because I after I found your podcast, I did more of like a deep dive on PTA elevation. So I was like, there has to be like more, So I got the coaching program and then yeah, and then so then I took it again and I waited 6 months again, like from July to January, and then I took it in January 2025, and then I finally passed with flying colors.
You want to share what your passing score was?
Yeah, I passed with a 716, which
Let's
is
go.
crazy because it went from like 570s, 540s, 580s to a 716. I was happy with a 601. I was gonna be happy with a 601, but yeah, so a 716, and that was wild, like when I saw it.
I knew you could do it. You like the last time we had met together on one of our one-on-one calls, I was just like, she's got this. I'm like not even worried right now. I'm
Yeah.
just like, I was like, I will bet Louie that she's gonna pass this, and that's my cat, so I would not bet. He's like my child. I would not bet him unless I was like very sure. But I knew she
Yeah.
was gonna absolutely crush it. So let's talk about, oh, actually, that's an interesting kind of thing. So we can talk about that as well. When you opened up the FSBPT website
Oh
on
yeah.
results day.
Yeah. So, I knew you had mentioned before about like seeing a withhold, and I was like, okay, well, like I said, like I was gonna be happy with a 601. So I was like, um, I didn't think the withhold I was gonna see that. So I opened the FSBPT website on like everyone was getting their results, everyone was getting results, and I was like, okay, well let me check. And it took like an hour and a half for my results to come out either way. But when I checked, it said withheld. And I was like, oh my gosh, like what does that mean? Like I was like, okay, I remember Bree saying that if you got a withheld, it's usually a good sign. So I was like, okay, but my heart was still like, I don't know what that means. So I Googled it. I was like, I was Googling everything, and I even looked on the FSBPT website, and it said like it can be withheld like for a number amount of reasons. And then also my test day, when I went there, there was testing issues within the whole Prometric Center. So I was like, that's probably why they withheld it, not because I passed with 100 points, but because like there was something like within the system, because I almost didn't take my exam. I almost had to get rescheduled. So I was like, that's why they withheld it, that's why they withheld it. And so I was just talking myself into I didn't pass. So
Oh no.
yeah. So then so yeah, so I got it withheld, and then I was messaging you and I was like, what does this mean? Like I know what you said before. You're like, this could be a good thing. And I was like, oh my gosh, I hope it is because like I was just everything was going through my mind. And then the next day at 10 a.m. Is when they released my results, and then it ended up being a pass. So yes, and then I was like literally by myself because my husband went to work, and my daughter was still asleep. So I was like hugging my dog. I was like, "We did it!"
Aw. That's so sweet. Yeah, when you sent me that, I was just like, "Oh, girl, it's probably because you got over a 700." Like
Yeah.
that's what I was like. I was like, "It's probably because you got over a 700." Like you probably passed. But yeah, that withheld score, like when you see it, because sometimes it does come out before like other people's results come out, and you're
Mhm.
like, "Oh my gosh, like what do I do about this? Like what does this mean?" Like it's very scary. But the
Yeah.
majority of people that I've worked with, actually every student that I've worked with that ended up getting a withhold score, all of them got that because their score increased by 100 points. So that's why I'm like always like confident that that's probably the
Yeah.
reason. But for context, on January 9th, there was a huge problem with Prometric where a bunch of people, almost like 20% of students, had their
Mhm.
exam randomly shut off on them and they had to go retake it and everything. This was also when like ice storms and giant snowstorms and all this other crazy stuff was happening around the country. So it was just not a good time.
Yeah.
So that can also be a reason why. Like it's all very logical to think that that might be a
Yeah.
reason why because of all the issues. But if that ends up happening or your test gets shut down, just contact Prometric and contact the FSBPT and they will fix it. But you were good. You took your
Yeah.
test. You passed and everything. And
Mhm.
so what's in the agenda next? What are you doing next?
So I want to get a part-time job. My daughter is now 2,
Which is
so
crazy.
I know. It is crazy. That's why I was like, it's literally been like a 2-year journey,
Mhm.
and it's just it's wild. But my daughter's now 2, so I still want to be able to be here with her, but I do want to get a part-time job, and like super PRN, like maybe work 2 or 3 times out of the week or whatever. But I do have a job lined up at a SNF. And it's for PRN, and it's super close to my house, super convenient. It's like everything's lining up perfectly. So yeah.
That's awesome. And like sniffs usually are making like $10 more than outpatient.
Yeah.
So there you go. That's
So
awesome. Yeah, and
that's
PRN
good.
sniff gig, that's what's up. So the last thing that I wanted to kind of ask you about is like if you could give like any piece of advice, and it could be multiple, like some people like I can't think of one. So if you give any piece of advice to any PTA student who's on their journey right now towards passing the boards, whether they've been in your shoes or not, what would you say to them?
I would say to not give up for one. Like never give up. Like push through. Even if you're on your fifth attempt, going to your sixth attempt, like just don't give up. I would also say to just like mental health is a big thing. So I would say focus on your mental health first before putting studying or anything, like PTA, like yes, it's a good job but it doesn't define you. It doesn't define who you are as a person. So get your mental health in check first and then like prioritize everything else. So
I
yeah.
think that's great. I 100% agree. If your cup isn't filled, you can't pour into other people.
Correct. Yeah.
Exactly. All right. Well, thank you so much, Breanna, for joining us on the Inspire series. I'm sure there's some students today who have been inspired by your story, and they really appreciate you sharing that with us and the raw moments and the real moments of, this journey. So, if they wanted to find you or like ask you any questions, where would they be able to contact you?
I'm on Instagram, Facebook, everything else. My Instagram is Bree Stapleton _. Yeah, pretty easy.
There you go. Awesome. Well, thank you again for joining us.
Thank
And I'm sure we'll have another student on the Inspire series too that's going to continue to inspire people to continue on this journey. Because truly, the only way you don't become a PTA is if you give up. That's 100% the truth. All
Mhm.
right. Well, thank you.
Thank you.